afternoon.
Good afternoon.
Good afternoon. We will start the webinar from School of Public Health. So I request Suresh Anand to give a brief introduction. Over to Suresh.
Yeah. Good afternoon, everyone. Myself, Suresh Anand, from the International Relations Office of SRM Institute of Science and Technology, and I'm very happy to see you all here, and all the participants and the host and the speakers and the moderators. And this will mainly talk about the ongoing situation, the COVID-19 situation. And talking about SRM, SRM is a multiple streams university. Multiple streams university in the sense we teach engineering, we teach medicine, health sciences, management, law, agriculture, hotel management. Over 215 programs we teach, right from bachelor's to master's to the research level. And we have talking about the internationalization, we have students from across the globe. There are students from more than 64 countries, from different nationalities, and representing across all the continents. And it's a very diversified campus. With regards to the scholarship for international students, we offer different scholarships. We offer merit, economic scholarships, different types of scholarship for students. And now I request Madam Kalpana to continue the meeting.
Hello, everybody. Greetings from the School of Public Health, SRM IST. Now we are here to talk about, is improving public health the way forward? Yes, certainly in today's global scenario. But before I be judgmental, we have to go through a series of process in this webinar to even convince all of you, certainly public health is the way forward. I'm here, Dr. Kalpana, from Associate Professor from the School of Public Health. I have my colleague, Dr. Geeta Velaya, who is the Assistant Professor, School of Public Health. And we are here to talk about what is the need of the hour. We are all in a crisis, not only in India, not only in Southeast Asia or Africa or wherever. Globally, today it's a demanding scenario with COVID. We are in a disaster. Amidst this disaster, this deadly pandemic, how are we going to fight? And certainly public health, I'm sure, is going to show the way forward. And we are all from different parts of the globe. So I should say good afternoon, good morning, good evening. And I'm very happy to welcome all of you. Now I would like to request my colleague, Ms. Geeta Velaya, to speak on what is public health all about? How would you define public health, and what is its future, and what is its scope globally? So she will throw light on all these aspects. Over to Geeta.
Thank you, Dr. Kalpana. Thank you, everybody. Thank you to the International Relations Department to have convened such an event. Like Dr. Kalpana said, we have a crisis in our hands as we speak. As of this year, COVID-19 will become a terminology in all the dictionaries because it's everywhere. So Dr. Kalpana has asked me to talk a few things about what public health is and why public health and how to is improving public health the way forward is what Dr. Kalpana has asked me to talk about. And as I am talking, I'm going to request Dr. Kalpana also to pitch in because both of us are colleagues and we've been colleagues. I've been colleagues with her for the past 10 years. She's been there for 12 years. So I think we have, a lot of experience between the two of us in different aspects of public health. So from my perspective, I'm going to talk to you about why I think public health is exciting and why public health is the way forward when it comes to addressing things like the pandemic that we are currently experiencing. So with that, I would like the slides on, please, if I could have the slides, or can I share the slides? All right, thank you. So the title is Improving Public Health. Is improving public health the way forward? So I'm just in conversation with Kalpana about this. So if I could have the next slide, please. Thank you. Okay, so I have a quote here, and he's the Surgeon General of the United States a long time ago, maybe around 40, 50 years ago. And he made a statement, and which is true today and will be true forever, because healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time. And that is why, not having focused on public health as much as we should have, we are in this crisis right now. Had we focused on public health, we would have had a different scenario. So what is public health? I'm not sure if all of you have a background in public health, but I'm just going to give a brief about what public health is and how it is important and why it is important and why now and why SRM Institute of Science and Technology. So I'm going to cover a little bit of all of that. And I request Dr. Kalpana to, pitch in anytime. I may be missing some things. So if I am missing, please kindly, make it as comprehensive as possible. So yes, thank you, Kalpana. First of all, we need to understand what public health is, okay? To understand public health, we need to define health. So all of us know the World Health Organization, everybody knows the WHO, and if they don't, by now they should, because of the crisis that we are going through, states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So that was the definition like 20 years ago or 25 years ago that was coined. And initially it was not mental and social well-being. It was only physical well-being. And then slowly mental well-being got added on and social well-being got added on. And now it is not merely the absence of disease. However, right now there is a transformation of public health, and public health is going into the sphere of not just being the absence of disease, but presence of health. It is a positivist approach that we are taking to public health. And we at SRM, at School of Public Health, are currently in the process of studying wellness and well-being, health as part of all of that. So if I were to, if you look at the picture in front of you, there is to the right, it talks about the body, which is your physical body. It talks about your emotions. It talks part about the psychological aspect of it. The environment, we have single-handedly destroyed our environment, and we are paying a price for it right now. And whatever we are facing because of abuse of the environment that we live in. Starting with climate change, plastic use, I can just keep going on. Finances, economy, we are right now, COVID has done a lot of damage, but prior to COVID also, we were not an equitable society. We are, far from finding parity with all the population that we serve. And we all need a purpose in life. Purpose is what defines where we are going. And public health, in my opinion, has a very fulfilling and satisfying purpose. And you do a lot, just not for your, the community that you belong to. So technically you're doing it for yourself as much as you're doing it for the community. So the purpose is a big aspect of well-being and wellness. And all of us, I think we should be having a purpose. Mind. Our mind is one of the very crucial aspects of how we cope with our life and crises and any setbacks that we may have. So, and relationships. Our relationships are our strong support. The cornerstone of our mental health is the relationships that we have. And finally, work. We work, most of us work 8 hours a day. Sometimes some of us work 10 hours a day. Some work 12 hours a day. So your work spot is as important when it comes to health. So when you put all this together, you're talking about what wellness is. So having said that, I'm going to say that globally, we're now having a transformation, and the wellness aspect of it is now, we take it as a continuum from illness on the left side to wellness on the right side. And all of us are there somewhere in between, okay? Some of us are, totally fine on a regular day. One day you may have a headache, so you're not all that well. So it keeps changing. It's a very fluid state from being well to not being so well. So we are here talking about the wellness aspect, which means that there is a balance between illness and wellness, and we are all there somewhere. The future of public health is the balance that we have to look at, wherein most of us are on the wellness side of the balance, the continuum. How do you do it? The only way to do it is the way public health shows: prevention, primordial prevention, primary prevention. So it is very important that we focus on primordial and primary prevention so that we do not spend a lot of our money on health care, which is secondary and tertiary prevention, and that is expensive. For many reasons, it's easier to promote primordial prevention, and because first of all, it's less expensive, it's population centric, it can be approached in multiple ways to address the multidimensionality of wellness and well-being. So if I could have the next slide, please. Okay, so I have the World Health Organization's COVID-19 webpage right in front of us. And that shows how no place in this world has been spared by a tiny virus. The tiny virus has taken over this world and has technically stopped. It is like, you know, we are on a complete standstill right now. Okay, so this was actually, you know, there was a premonition of sorts, I would say. Mr. Bill Gates had actually talked about this a while ago, that there is likely to be a pandemic of this nature. And we in public health, we're focusing on multiple other things like chronic diseases, infectious diseases. We thought we had gotten a good handle on. We had thought, okay, we know Ebola, we know dengue, we know that we can handle all of that. Never did we think that we are going to have a crisis of this kind, where people like me are working from home when I would love to go stand in class and talk to my students, you know. And COVID has had a, I don't know, a humongous impact on our lives. It's just, you know, not, you know, it's like, you know, work is one aspect of it. Some of us are, you know, going through loss of family members, loss of friends. Some of us, you know, I know people, migrants that I know, some that have had absolutely no way to help themselves because there's no jobs available, nothing is out there. So people are being pushed into poverty. So what is COVID going to do? COVID is actually going to throw us back 10 to 15 years of economic development that the world has had, because that is the kind of damage COVID has done. By, you know, we are on a standstill, nothing is working. So it's time to reinvent public health. How do you reinvent public health? We need to work together. Like Suresh sir was saying, School of Public Health works in tandem with so many departments within the SRM Institute of Science and Technology campus. We work with, you know, biotechnology, we work with biomedical engineering, we work with genetic engineering, we work with everybody. Right now, that is what we need to do. But we also have to focus on how to primordial prevent and primary prevent. So can I have the next slide, please? All right, so here we have something that says health experts blame failures on America's leaders. I have this on because I follow a lot of what happens in America, well, because most of my family lives there. However, I used to live there too. I did public health in the US. So I know how we looked at America as this beacon of whatever, you know, we imagined it to be. Lo and behold, I have to take that back. Even when I was there, it was a very different kind of public health. So here we are looking at how America's leaders have failed America. So at some points in time, public health or health in general needs strong leaders, people that understand the complexities of what health is all about and how to achieve primordial prevention, which is to have zero risk factors. We can do that. And there are ways to do it, and we have been doing it. Some traditional systems of medicine have followed, you know, daily rituals that have helped people be healthy. There are people that have lived to 100 years, functional lives. They've lived functional lives. So leadership, there's a vacuum in leadership. And it is very obvious now, COVID is actually kind of, you know, thrown open the lack of leadership that we see everywhere, not just in the United States. I can say that, you know, with respect to the state that I live in also, I'm not very, you know, happy the way they have understood what was happening. And we are still trying to find a strategy So this is where, when Dr. Dr. Kalpana was asking me about what can we do to improve health? Why public health? Why now? The now is very evident because if we do something about it now, we would be working with whatever the damage that COVID has caused for the next 10 to 15 years. We would be working with this because that's the kind of damage it has done in less than 3 to 4 months. Like if Wuhan is the beginning, it's in December or November, from November of last year to now, it has created damage that we are going to be, working on trying to understand for the next 5 to 10 years. That's the damage it has done. So our focus right now will have to be about primordial prevention. How can we be healthy? Why is that important? Because if you look at what is happening in the mortality rates anywhere in the world with COVID, it is very evident that people that have chronic diseases like diabetes and hypertension are likely to succumb to COVID, while people who do not have comorbidities come out cleaner, although they do suffer a bit, but they are living at the end of it. While people with diabetes and hypertension are likely to succumb. And why is that happening? Why is, I'm going to go through some of those slides a little later. Why is diabetes so prevalent? I mean, I do, as a part of my daily routine, I look at the statistics that the state of Tamil Nadu puts out for, every day about mortality with COVID. Every day I will see the combination of diabetes and hypertension, and that's all I get to see. If there was 30 deaths, 17 or 20 of them are because of hypertension and diabetes, compounded by what COVID has done. So we are already compromised in our health. Our inflammatory processes in our bodies already compromised when you have diabetes and you have hypertension. That, when COVID hits, is going to take it to a very different level. And sometimes we do not seek help at the right time either. Maybe some of them that have died, if they had sought help earlier, maybe they would have lived. We don't know. So there's a lot of ifs and buts about what COVID is doing, or COVID, how COVID works. We don't know. But, we need to prevent this from happening again. How can we do that? Ensure that children that are born to healthy mothers. Children that are born are healthy all their lives, through their childhood, through their adolescent years, through their young adulthood, through their adulthood, and when they become a senior. Ensure that they are on the wellness side of continuum and not towards the illness side if they can help it. And if we as a system, health system, we should be there trying to move people towards the wellness side of the continuum and not keep them even in the center. That's my, my wish list. Could I have the next slide, please? Okay, so this is Thomas Alva Edison. Years ago, he says the doctor of the future will give no medication, but will entrust his patient in the care of the human frame, diet, and the cause and prevention of disease. So that is public health, and he has put it in a nutshell. There is going to be, his vision was probably no hospitals at all. I mean, that would be ideal. No hospitals. You just go, take medication. That is all natural. You don't really need synthetic drugs if possible, and keep healthy. And you are self-actualizing. So we have, like I said earlier, social determinants of health is very important, and that's what he's talking about: the diet and the cause and prevention of the disease. So we have more than just physical health that we're talking about. We talk about where we live that matters, what we eat that matters, what we do that matters to improve our health. So in public health, we focus on all of that as well. So at SRM, we have embarked on making our campus a very safe and a thriving space for all by promoting wellness and well-being. SPH has pioneered an effort to change campus norms that hinders well-being by promoting the university wellness program. This is a very unique program that we have started 2 semesters ago, thanks to the dean. It was her vision to start to work with our own campus first. And that gave us a brilliant opportunity for our students to use our campus as a way to learn their topics. Every semester, whatever that they had to take, they would apply what they've learned through the University Wellness Program. So it gave them a platform to apply what they learned. And the past 2 semesters, my students, I should say, have done a remarkable job of getting baseline data of some health indicators. We've done a basic baseline study. The UWP tagline requires mention here because it's university wellness and universal wellness. The aim and the vision of it is to make a small beginning at our campus to improve wellness of our students, faculty, management, housekeeping staff, everybody that works on campus. Okay, this, if we can show a very functional and effective program, this can be replicated in most universities. This platform offers students to learn research methodology, biostatistics, talks about social and cultural aspects of health, talks about health communication, talks about population health, talks about epidemiology. It gives them the opportunity to put together and understand public health in the microcosm of the university as the location. So, having learned these skills here, all they need to do when they go to their jobs is to apply these skills. And having had practical experience, it gives them that confidence. And I should say that, my students, the past 10 years, all my students have been placed in good positions and they all do remarkable work. Some of my students, the batch that passed out, are working on COVID through, different local departments of health. So we have, a very unique program in the University Wellness Program, which is a very, it's an innovation of sorts. And we also have other programs. We do research. We do research on different topics. One of our strengths is to work with the indigenous. We work with the tribal communities in Tamil Nadu. We do a lot of research in population health, and we are also the field agency to do the demographic and health survey for the state of Tamil Nadu, known as the National Family Health Survey. So we are part of coalitions that work in promoting health. So with this, I can go on to the next slide. Can I have the next slide, please? All right. So here we are. This is the slide that I wanted to talk to you guys about earlier. These are the most common conditions that we were talking about. Pre-COVID times, we were talking about heart disease, we're talking about diabetes, we're talking about cancer, we're talking about mental health, poor mental health. And we talked about infectious diseases seasonally. When it's influenza time, if it's a flu time, we would talk about flu. If it's a swine flu time, we talk about swine flu. If it's dengue time, we would talk about dengue. So it was seasonal. It was not, as drastic or dramatic as it is now. So now infectious diseases has come to become a common condition because it is stark in our face right now. We are living, a condition that is causing so much harm across the globe. So here we are trying to figure out why is COVID, this destructive. Poor health. So you can go back to understanding what our lifestyle is all about. Our lifestyle has set the foundation of our health currently. People are having more sedentary lifestyles. They eat a lot of, junk food. They have not kept up with their managing their stress. They have done a lot of harm, causing hypertension. Hypertension is a risk factor for heart disease. Causing diabetes. Diabetes is a risk factor for heart disease. Poor lifestyle. Some students also, students and young adults tend to take on substance abuse. They are, using drugs to cope up with their problems. So all of this, cumulatively puts them in the compromised individual. And when you have an infection like COVID or any flu for that matter, it could take you down. It could keep you unwell for a long period of time, or it may even kill you. So common conditions we used to be talking about chronic diseases, and we didn't talk as much about infectious diseases. But right now, we are staring at both. It is like on your face right now. Could I have the next slide, please? Okay, so I'm just going to shift gears a little bit, and I'm going to talk about where do you find public health people? What is the prospects for public health people? You find them in health departments. Most health departments have a lot of options to work either in chronic diseases or in infectious diseases, or in the departments where there's the tobacco control area. So there are lots of places that you can be placed if you work at the health department. I worked in the health department myself, so I can tell you that everybody around me were all public health students. There are nodal departments of the central and state government. Some of my students are currently working in projects in ICMR, which is a central government agency that works on policy and research on health, and many of them work in state governments as well. Many, I know that my students are placed in international NGOs. Some of them work for UNICEF locally. Some of them work for UNICEF outside of India in places like Africa. I think some are, one of my friends, one of my students used to intern at the WHO. So there's a possibility to work with local NGOs or international NGOs. IT companies, students of mine have become business analysts, and they do work with developing softwares and medical devices that require understanding of the variables that you need to take data points and make it available to make a wearable. Clinical trials, many of them have gone in to work with the pharmaceutical companies, and they work in the clinical trial area. And students of mine are working on policy and advocacy and think tanks in and around India and outside. And some of my students have gone ahead and they have joined PhD to do their PhDs as well. Could I have the next slide, please? All right, so positions in public health, you can be epidemiologists. Many people now understand epidemiology because COVID has made things like flattening the curve, R0, everything a pretty common lingo these days. So, epidemiology is a very strong field in public health. Biostatisticians, people that crunch that data and understand what the data means, lots of opportunities for them. Particularly, I'm going to go ahead and I'm going to also subsequently talk about the programs that we offer, because biostatistics is a part of most of what we teach in public health, in other master's programs that we have at the School of Public Health. Population scientists, people that understand population health, that understand demographic, health surveys, etc. And health communication specialists, people right now, health communication is an up and coming area, particularly with COVID. There's so much of information out there that we do not know what to believe and what not to believe, because it can actually cause you to go into depression because it's all kinds of information. So there is a need to understand how information needs to be credible and effective. So health communication is a huge area. Again, I talked about clinical trial coordinators, IT and business analysts in IT sectors, policy and advocacy specialists, people at the level of the government finally make it to the policy area where they are drafting policies for the central and the state government. And many people work on water sanitation across the world, nutrition and child rights. Could I have the next slide, please? All right, so this is just an example of how we want to work with prevention. What is it that we do? When I say prevention, what can public health do? Through outreach, education, and advocacy, we can improve physical activity, healthy diet. I'm sorry, there's a small typo there, sorry. Physical activity, healthy diet, and stress management. These are three attributes, three activities that we need to, behaviors, I should call them behaviors. We need to look at if we can handle these three, and if we can promote these three very early in their lives, most of their health issues will be taken care of, because obesity will not happen. People will have better mental health. They will have good nutritional health, and they'll be, their immunity will be much better. Handling stress, through yoga, meditation, you name it. There are so many ways that one can handle their stress. The coping strategies, if you give them the right coping strategies, you are going to have healthy individuals for the longest period of time. So that is what that is what public health does. And how does it do? Through outreach, through education, through advocacy, through innovation, through leadership, a whole load of these things. And we at School of Public Health are promoting outreach, education, advocacy, building, capacity building, skill building of our students to be good leaders when they finally go out and represent public health, because it is all about us. Can I have the next slide, please? Public health and well-being, I'm talking about, it's an exciting multidisciplinary field that provides opportunities for everyone. You could have an arts background, we still want you. If you have, if you can write, we want you to come and become a health communication specialist. We want you to write about what is happening. We need to document what is happening. The documentation can be through print, could be video. There are so many ways that we can do that. If you're an artsy person, we want you. If you are a person with life sciences, there's so much that you can do for us. It's like understanding, if you're a microbiologist, if you're a biochemist, if you're, I'm my basic, one of my pre-doctoral degrees in endocrinology. I understood endocrinology because I liked physiology. And and physiology gives me a great understanding of, the current diseases that, the chronic diseases. So if you understand science well, you'll bring the perspective of science to the public. And that is something that is required all the time. Economics, we want economists with us because we want to understand how our policies impact the poor, how the policies can be made to, bring about equity to everybody. For that, we need people who understand economics. So people who understand commerce, who know how to budget. We need people who can budget. We need people who understand finance. So everything, it's multidisciplinary. It's a whole, it's like you could be doing anything. You would find a place in public health because it's interesting. It is, to me, I guess I'm totally in it. So, population sciences, epidemiology, data analysis, collaborative, people-centered specialty. That's what I would call it. It's a specialty that is population sciences centered. It is epidemiology, data analysis. It's also a lot about the people. When I say a lot about the people, I include myself. So when I'm crafting policies or if I'm trying to understand what works, I also believe that whatever I'm doing is going to impact me and my family and my friends. So I'm not doing it for others, I'm doing it for myself as well. Could I have the next slide, please? All right, so I'm going to walk you through SRM as we go. This is the campus. Because of COVID, I don't see it as often, but this is the campus and it's a beautiful campus. And I've been there for 10 years, so I can tell you how exciting it is some days to walk down the road there, although I don't walk as much as I should. So could I have the next slide, please? All right, why SRM School of Public Health? We were initiated in 2007, and I would request Dr. Kalpana to pitch in because Dr. Kalpana has been there earlier than me, and she's done a lot of work in this area. So, and why SPH? Committed, diverse, and experienced faculty. All of us there are very committed, very energetic, very interested in what is happening, in the multiple dimensions of health. So we use technology, we use, just regular, work surveys and, all those normal things also, but we also look at innovations. We do a lot of innovative programs. One of the innovative programs I talked about was the University Wellness Program. Innovation is where, science and public health, science can bring to public health, or any, field can bring to public health. Innovation, trying something that's never been tried before, or just create something that's never been thought before. So things like, if you used a Fitbit to understand how many steps you take, all those wearables, they're all inventions, and the cell phone, using a pedometer on a cell phone, you use all kinds of apps on a cell phone. So all of that are innovative research that can help our health. So we are in the process of working with different departments and trying to understand how we can work collaboratively, because public health is collaboration. We do exciting research at multiple levels. We are looking to work on, currently we're working on hepatitis, hemoglobinopathies. We are working on the National Family Health Survey, which is the demographic and health survey. So we have at any given point in time research projects that can also interest students, and they've also our students have contributed to our research as well. And we have a very active alumni network, like Suresh sir was saying earlier. We've had people from multiple countries in Africa. We have people from Syria. We have people from Afghanistan. They just passed out. And we have students from Nepal, Bhutan, Bangladesh, Sri Lanka, the whole SARC area. We've had people from Malaysia. We have people from many parts of the world. So, and we have a very active alumni network, and people that, keep in touch with us even till date. And if there are opportunities, we get to know about it as early as it is possible. Could I have the next slide, please? All right, so why SRMSPH? I have put down pedagogy, how we take classes matters a lot, engaging the students is the name of the game. If I'm not engaged, I'm not gonna learn. So we teach students as much as we can, we teach them in the applied fashion. What you learn, you do. When you do, you remember, right? So you have to apply what you've learned. And also when you apply what you've learned, you'll also realize that in the real world, what you've learned in theory may not, you cannot apply it right away. It has to be adopted and adapted. So applied pedagogy, we teach them, like the University Wellness Program becomes a platform for them to apply what they've learned in that semester. So we have flipped classrooms, and this is a feature of the medical college. They have what is called flipped classrooms, wherein the teachers give the work ahead of time, and there are discussions and case studies through which we learn. There are case studies, there are role plays, you name it. Education has to be fun because we are learning and we want to retain what we've learned and retrieve it later. So there is a balance of self-learning and didactic lectures. We also give you assignments, we give you tests and things like that to understand and evaluate whether you are getting what we are teaching. And you do independent seminars as well. Could I have the next slide, please? Okay, the postgraduate programs that we offer, if you've looked at it, if you looked at our website, you would have seen it. Master of Public Health. In that, it's a 1.5-year program. Dr. Kalpana, please pitch in. It is more your expertise here. 1.5 years of classroom work. Can you stay in the previous? Yeah. 1.5 years of classroom work, and then a 6-month internship. And when you do your master's in public health, you would do public health management as you can do public health management as one specialty. We have biostatistics and epidemiology as the other specialties. The other group that we offer is the Masters of Science programs. We offer epidemiology and biostatistics and health data science. Could I have the next slide, please? The eligibility for master's programs, of course, any bachelor's degree that is recognized in your country but at the university, 50% aggregate score. There'll be an interview and an exam, and for people outside of this country, It's just the, it's a Skype interview. It's like get to know the person kind of a thing. So for epidemiology, you can go to the next slide, please. For epidemiology and biostatistics, the only difference is you need to have had math at the higher secondary level. So because it involves biostatistics and epidemiology. Other than that, the eligibility is the same. Could I have the next slide, please? The next one is the health data science. Any applied, any bachelor's degree, 50% aggregate score. An interview and exam for people outside, it's a little different. The other requirement here is studying, you should have studied computer science at the higher secondary level. So it's that, because I'm going to go over a little bit of what these core courses are going to be. In public health, we talk about social and behavioral aspects of health in public health. Masters in public health involves the core modules involve social and cultural aspects of health, epidemiology, biostatistics, population health, economics, health communication, women and gender issues, health systems and policies, health promotion, health program management, environmental health and sustainable development research methodology. These are some of the core courses of the Masters in Public Health program. The Masters in Health Data Science, the slide that you see right now, some of the more modules that you're going to, undergo is fundamentals of biostatistics and epidemiology, Python programming for data analytics, there's big data technology, there's big data security, there's algorithms for advanced data analytics, data analysis using SAS, categorical data and survival analysis, and non-parametric methods. This is to name a few. These are core modules. And for epidemiology and biostatistics, it is basics in biostatistics, statistical inference, sampling methods, demography and health statistics, fundamental measures of diseases, clinical epidemiology, design of experiments, regression analysis, categorical data analysis, survival analysis, to name a few. And in epidemiology, you understand about epidemiology for communicable and non-communicable diseases, advanced and emerging specialties in epidemiology, research methodology, and bioethics. This is just to name a few. So it is a very comprehensive program. Having said that, I need to say that Masters in Epidemiology and Biostatistics, from what I know, not many universities in the world, globally, not many universities offer this combination of epidemiology and biostatistics. Very few universities offer, and we happen to be one of them. Can I get the next slide, please? So I talked about the health data science, and also we offer bachelor's in public, Bachelor of Science in Public Health. That's a BSc in Public Health. And what is the requirement? Secondary or high school pass, science, commerce, arts, or humanities, can be of any stream. You're eligible. The next slide, please. Physiotherapy, okay, I'll talk about it. So this is my last slide here. I have Dr. Kalpana's information. I can always give my information, and I have Ms. Gajjalakshmi, who's the office in charge right now, and her information is there. If you have any questions, concerns, like you want more queries answered, clarifications, you're more than welcome to write to us or call us. So Dr. Kalpana, if there's anything else that you want me to talk about.
Well, Geeta, that's public health very nicely explained and defined with its scope. Well, we are all aware that the need for public health at this critical juncture is really at a very great demand. And we all know that prevention is better than cure. It's a striking public health concept. So what happens is, we were all looking for prevention is better than cure, but what happened, we were speaking about environmental engineering, we were speaking about health and hygiene, we were speaking about so many concepts, conceptualized so many things to bring about a healthy society. And WHO talks about physical health and mental health, well-being, defining the right kind of health. Now we have to talk about social well-being also. This tiny weeny virus has brought the globe on a standstill. All of us are under panic. So we are trying to bridge allopathy, we are trying to bridge traditional medicine. At this time of despair, we are looking at an antidote. And you see newspapers, you see social media, you see the television media, everything speaks only about this COVID-19 corona, and all of us are under panic. this has taken a terrible toll on the mental health of people. So we have a lot of online counselings going on, like telemedicine and things like that. It's more than anything the fear and anxiety of being in a hospital, being on a health setup, and the social medias and forums have created such a fear, such a sort of a trauma in the minds of the people, and the alarming tragedy rates, fatal rates, and things like that have driven people amok. It's not only that the unemployment, the need for money, finance, economic loss, recession, everything has put a toll on this social capital globally. So we talk so much about social capital. We're talking about social capital, its well-being and things like that. But what are we doing about this at this critical juncture? So we were Geeta very nicely spoke about the university wellness program, which is one of its kind, and which SRM University has started just to promote the health and well-being, where people are taught to be, very de-stressed, good mental health, saying no to drugs and saying no to suicide, and so many things. And I am sure many of this will be a trendsetter for other universities to follow, not only in Tamil Nadu, not only in South India, but all over the world. This university wellness program has volumes to say, and I should say thanks to our dean for promoting this. So what happens is, public health speaks a lot about mental health, and mental health and well-being is a real need at this hour of trauma, because every other person I see, I talk to, and I do a lot of online counselings and things like that, because people even can't wait to see a psychotherapist or a counselor. They want to talk online, they want to come on video chat, they want to express their problems and that agony and the anxiety. So we all of a sudden we find so many cases of anxiety and depression is at a very great percentage. And of course, like Geeta said, public health is multidisciplinary, and we deal with everything, not only the physical well-being, not only prevention, but also mental well-being and things like that. So what happens is, undoubtedly healthcare is very vital at some times, but health and well-being is vital at all times. So I think now slowly we are all at a setback. So what people followed, the discipline, the social distancing, health and hygiene practices, wearing a mask, washing yourself, keeping yourself clean, sanitizing yourself, everything what was practiced in the yesteryears has now come to being as of late, and I think this will continue. And I think this trend will set a very nice, clean, healthy, and hygienic society, and I'm sure. So now I throw the forum open. Thank you, Geeta. It was a wonderful talk. Now I throw the forum open to questions.
It's our talk.
Questions or doubts? And somebody asked me about physiotherapy. Yes, as I said, public health is multidisciplinary. We have with us a lot of physiotherapists pursuing this master's in public health, and it's very good. Mr. James, you would like to know more about the School of Public Health? Well, School of Public Health has been founded in 2007 by our then Dean, who's now the officiating Vice Chancellor of the Sikkim University, of the SRM University at Sikkim, Professor Satish Kumar. And it has come a long way. We have completed a decade and a quarter, and it's it's a multidisciplinary program. We do training, we do research, we do teaching, and you must have seen the various undergraduate and the postgraduate programs, and there is the PhD. We have both the part-time and the full-time PhD, and we have people from UNICEF, from the ministry, and from various parts of the globe pursuing PhD with us. And we have a set of experienced faculties. So it is it's a future promise to the society to offer excellent health specialists from the School of Public Health, SRM University. Well, this question about if there is entrance to the UG, no. We assess the student having a personal talk on the Skype or the Zoom, and based on the marks secured on the +2 or the pre-university or the ICSE, we select the students.
Dr. Kalpana, I failed to mention something. We do have student exchange programs, and currently our students intern at Teesside University in the UK, and we also have a memorandum of understanding with the Rotman School of Management in the University of Toronto. So we are global in many ways. So if at all you want to look at global health, we're also part of global health. And having lived in the US and worked there for 11 years, I have a perspective that's of a developed country, but having come to India, it's home. I've had a different understanding of what public health is. And I always tell students that I have understood public health much more here than I did there, because perspectives are very different. And so we have a lot to offer, as public health. So just my 2 cents. Thank you, Dr. Kalpana. Sorry.
More questions, please.
So James, he raised his hand. So James, can you talk?
Yes, Mr. James. Can you voice your questions, please? And James, you are from?
Mr. James is from
Hello? Mr. James?
Yes.
He's
He
from
has
Kuala
to-
Lumpur.
A little louder, please.
He has to unmute.
Yeah, please unmute. Mr. James, can you be a little louder? Hello?
I don't know. Another person, Dennis, has asked some question.
Yes, Mr. Dennis.
It's asked a question. Thank
What's
you.
your
I would
question?
like to know. Oh, he says he wants to know if one can pursue a postgraduate diploma in public health long distance in our college.
At the moment, we are not promoting a long distance program, but in today's scenario, I think the university will surely look into it, and we can come back. We have given you our email address. If you could write to us, I think we can look at some prospects for you.
Anybody else?
Yes.
I think I just like to come in briefly. Kartar Singh here. I
Yes,
just
sir.
want to compliment Dr. Kalpana and Dr. Geeta for the excellent presentation. I think it was a very comprehensive presentation you made. You brought in all the facets of the public health domain. And I was particularly interested when you said that health communication is also something that you focus on. And I think that is going to be very important, because we have seen, you mentioned about leadership. And I think in many countries where leadership has not listened to public health experts, not taken on board what the data is saying, I think they have suffered.
Yes, sir.
They have really suffered, and we're seeing the consequences of those actions. So I think that only pinpoints the importance of what you're doing, what you're teaching, the role that you have in the whole health system. And it's really interesting to see also that you have a good alumni network. I know a lot of students, particularly from the SAARC nations and possibly even from Africa, they look towards the School of Public Health. You really have a very strong reputation in that area, education and outreach. And so just wanted to to thank you more than anything else. Yeah, thank you.
So thank you for the opportunity, sir.
So behavior change communication is very essential, and Gita Velaya is an expert in that. We need to change the behavior of people, and especially in this COVID disaster, unless people change their behavior, and that kind of behavior change will promote health and well-being of the society.
Maybe if I could just ask Suresh, I think we have some scholarships for international students.
Yes, sir.
If you can just touch upon that.
Yes, sir. Sure. With regards to the scholarships, and we have scholarships for both the undergraduate and the postgraduate programs. We offer an economic scholarship for mainly students coming from Asia, that is forest, and also from SAARC nations, and students coming from Africa. So if they apply from these regions, they get a 40% economic scholarship on tuition fees. So that is a scholarship we offer for the School of Public Health. So the tuition fees for the postgraduate in public health program, that is Masters in Public Health, is $4,000 per year. And for bachelors in public health, it's $3,000. So these are the fee structure that is before the scholarship. And on that, we have a 40% economic scholarship for students coming from SAARC, forest, and African countries. So that's on the scholarships.
Thank you.
Thank you, sir.
Suresh, can you throw more light on facilities offered for students from Bhutan?
Yeah, we have a separate international hostel for students, for the international students. So that has like different types of hostels. Like we have international hostel with double sharing, triple sharing, 4 sharing rooms, and also international students can also opt for domestic hostels that we are offering like from this year. So that's more economical for students who are looking for economical options. And all the hostels within the campus premises, it's a very safe and secured campus. And for students, any basic amenities, right from banks to ATMs to bookstores, supermarkets, restaurants, food chains, it's all like within the campus. So it's a very handful.
I think Dr. Kalpana was
so very
talking
diversific campus, as I mentioned. Yeah. So you have students from all.
I think yes, Bhutan, Suresh, is there any special?
No, Bhutan, like we have a, yes, no, Bhutan is same as like any other country. Like, they have that 40% scholarship, like, which is for SAARC. They comes under SAARC. So the fees structure is like, they have like 40% scholarship on the tuition fees. And mainly we get students from Bhutan, like mainly sponsored by the Ministry of Education, Bhutan. So they comes under the government scholarship from Bhutan.
Actually, at this moment, it's my privilege to say, Nepal has one of the largest number of colleges giving a Bachelor of Public Health program. But when it comes to Masters in Public Health, most of the Nepal students who are doing Bachelors in Public Health and of course other courses also, their first choice is School of Public Health SRMIST because they feel at home here. They have a lot of their counterparts, their colleagues or their seniors and juniors here. They make friends easily and most of them like to stay back to work and things like that. So we every year by year, School of Public Health is very happy and it's to nourish a wide network of alumni from Nepal especially. And these students feel at home with us and they reinvent their culture and they rediscover everything of themselves in India and they stay in touch always. And many of them want to come back to work with us. So I'm very, very proud to say Nepal is very close to our heart.
Exactly, madam. Rightly said. We have like more than 75 alumni in last few years, especially from Nepal, and particularly for MPH and MSc Epidemiology and Biostatistics program. So, like, as you said, like we have like close to 75 alumni from Nepal alone for this program.
Dr. Padma, they want you to share a few words.
Ma'am, please come online to share a few words about School of Public Health. You having the lead for all of us.
Hey, Dr. Padma.
Hello. Hello. Good afternoon to everybody. It's a great pleasure to be joining in on this webinar. Thanks very much, Geeta and Kalpana, for wonderful presentation and handling this. And thanks to Dr. Kartar Singh and Suresh for organizing this. We will be more than happy to welcome any of the students. If they are interested, please do not hesitate to write to us about any doubts you have. We welcome all kinds of background because public health, as Geeta was saying, is multidisciplinary. And more so now, because we realize that even somebody who has done BTech in architecture is very, very important in urban planning, which affects public health, which affects the way that we construct in a city, in a densely populated city, and where we don't have much of green space and so on. So we need to change our mindset in the way that we are living currently. And that you can do by gaining some education, some exposure with us at Public Health, School of Public Health. So once again, thank you all for joining in and hope to see some of you with us.
Thank you.
Thank you.
As we already said, public health is not only the medical and health sciences, but we have an array of engineers, accountants, economists, journalists, even the legal professionals, because it involves a whole lot of ethics, legal practices and everything. So we have a bouquet of specialists pursuing this postgraduate program, not only in public health, but also biostatistics, epidemiology and health data sciences. And once the student moves in, we make them feel at home, and they really have a fantastic 2 years. And most of them leave in tears because in fact, we just completed our course with the students from Afghanistan and African countries, Far East countries. And they all said they would miss India, they would miss SRM. So this gives us a moment of pride, a moment of, that well-being, sense of belongingness, which we would never like to forego for anything in this world. So we like to welcome whoever is interested in pursuing public health, and I'm sure you'll all feel at home at the School of Public Health, SRM University. Any questions, please? Hello? Any questions? It could be about the course. It could be about SRM, anything. We are here.
Dr. Kalpana, can we mention few projects what we are working with the government, like that,
Yeah,
Puducherry or?
Yeah.
And we can close.
In fact, a feather in the cap was we were given the National Family Health Survey, which is a real top project in the country to do. And we represented Tamil Nadu, North and South. And that, in fact, the project came out very well. And we have a small gap now because of the COVID. People cannot get into the field. We have a lot of projects at ICMR, and now we have been, in fact, I've been awarded one from ICMR, where we are planning to set up a care center, mental health care and counseling for students in distress, preventing drug addiction, suicide, and all the potential stressors. Then we have a lot of programs on hepatitis. Geeta did a lot of ICMR projects on malnutrition and other things, and we are into a lot of government programs, and also the MNREGA, the government projects on handicap needs, and many of the projects. School of Public Health becomes the first choice. So we are always hands full with 4 to 5 projects at a time. And I think Geeta wants to say something about the projects.
No, I mean, we've had multiple projects. We started with a few projects from UNICEF initially, and we did a lot of, I'm particularly interested in nutrition, malnutrition, and we worked extensively with the government also on the ICDS. And then subsequently we worked on the health systems, and we found a way to evaluate how well the health systems were functioning. We also did work with migrants. We did work with the smoke-free Chennai. We worked with hemoglobinopathies, all about blood disorders. We currently have an ICMR project it's a 3-year project. And like Dr. Kalpana said, we are the NFHS field agency. And we have, right now we're looking to, for projects that will have a bigger scope so that it can, have big impacts. So with different vision, we have a different vision because of currently when leadership changes, we've had a change in leadership, and that's given us a new fresh look into how public health can be perceived in the long term as well as the short term. So currently we are having 4 or 5 projects from ICMR and the National Family Health Survey. We've also worked with Microsoft Finland at one point. We developed an app for tuberculosis. It was about compliance of medications in tuberculosis. So we've had multiple projects with multiple funders, and and had successful projects also. And many of them, some of them have become, we've also published the data. So. And Kalpana, there's a question here. It says, I did my graduation long back and worked in pharma marketing and currently with social marketing for health. Is there any opportunity for distance learning in public health?
At the moment in public health, as I said, multidisciplinary, and it needs institutionalized study. I think maybe you could go on a sabbatical for 1.5 years, finish your program and pursue internship in the same company you're working. At the moment, public health does not have much of distance learning programs. However, should we think of it in this COVID crisis, we will surely come back to you. You have our email ID, please write to us.
What is the scholarship program for students from GCC?
I think Suresh Anand will be right to answer. Suresh? Can you throw light, Director Sir, Mr. Kartar Singh Sir, can you throw light on...
Madam, yes, at the moment there is no any specific scholarship for students coming from for GCC. We have only for SAARC and African countries. So there is no any particular scholarship for particularly for the health sciences program for students coming from from GCC.
In fact, we would like to welcome projects from the international scenario where we would like to have a comparison between the Indian scenario and whichever country from. We are really looking forward to working with you all. Southeast Asia, Asia, Far East, SAARC countries. Yes.
So is there anything, any questions?
Any more questions?
I think
any more questions, please? I think I'll take this opportunity to thank Mr. Kartar Singh, Director International Relations, Suresh Anand, Venkat Narayan for giving me and Geeta this wonderful opportunity to present this webinar. And we are looking for more such opportunities. Thank you.
Yes, ma'am. Again, once again, thanks to everyone. Thanks to Professor Geeta, Professor Kalpana, madam, for being hosting this webinar, and thanks for your time, and thanks everyone for being a part of this webinar. And any questions, I already given my email, our email ID in the chat box. You can contact us for any related queries. And thanks everyone. Thank you.
Thank you all.